So with winter on the horizon, almost here, I reckon, the annual flu season is also fast approaching. But under the COVID-19 pandemic, many families are unsure if they should be taking the flu vaccine to mitigate against severe flu. The National Institute for Communicable Diseases has recommended that everyone, in particular those who are at high risk of developing severe flu and flu-related complications, receive a vaccination ahead of the season. But what does your doctor say? Let's answer that question for you now. We're joined by medical practitioner Dr. Dave Kaplan. He joins us via our video link. Doc, it's great to have you back on the AM report, and just in time for winter as well. So, you know, just sort of a quick answer from you. Should I be getting a flu jab, given that the vaccine rollout plan is starting next week?
Absolutely. It's very important that people who are at risk get a flu vaccine. What is even more important is that by getting the flu vaccine, you are going to help the healthcare professionals from an overwhelming situation like we've recently seen in India, where the services are completely swamped. So if you can have a vaccine against the seasonal flu, it will mitigate against you getting terribly sick and therefore having to go possibly to hospital and then overloading the system even more.
Yeah. So it mitigates against developing severe flu. Does it help me in any way when it comes to COVID-19?
No, not at all. The vaccine for COVID-19 is one vaccine, and the one for influenza is another vaccine. The very important thing to consider is that there are two major serotypes, H1 and or H and N, and every year there's what's called antigenic shift and antigenic drift, and there are organizations in the world that 6 months before the flu comes to that area of the world, they define what is the most likely viruses to protect us against, and that's how it changes from year to year. But it's very important that we do this flu vaccine, because in people who are susceptible, like people with asthma problems, people with heart and lung diseases, people who have diabetes, in fact, generally all the comorbidities that we all know about for corona, that's what we've got to try and inoculate against. And it's not that expensive. It's about 120 Rand, and expense is relative, but a visit to the hospital is going to cost the family a lot more than the flu vaccine.
So, Doc, you know, you've mentioned people with comorbidities that should be at the top of the list when it comes to getting the flu jab. Do we know, you know, given that people 60 years and older, they're going to be at the front of the line for phase 2 of our COVID-19 vaccination program, do we know whether there's any kind of adverse interaction between these two vaccines?
Yes, I spoke to Professor Richards recently about this very subject, and generally, if you can have the vaccines about 2 to 3 weeks apart, that's the ideal, because there have been people who had a flu vaccine, and when they came to get their COVID vaccine, they were told that it was too close, and then they said they should come back a little bit later. So just to give yourself a little bit of a gap, it should be not a problem. So if you know that you're going for corona vaccine next week, it's not a good idea to have the vaccine today. But I'm not saying that you mustn't have the vaccine. I'm just saying have it about 3 weeks to 4 weeks apart, if you can.
Yeah. You've talked to us about, you know, those who are at high risk for flu in terms of comorbidities, but what about the rest of the country, just in terms of, you know, whether pregnant women also fall into that category of people who are at risk of developing serious symptoms as a result of the flu?
Yeah, pregnant women at any stage of pregnancy should have the flu vaccine. Of course, we always have the anti-vax people who believe that vaccines are not good, but in this particular case, with the corona pandemic in the world at the moment, it would be best, if you can afford the vaccine, to get the flu vaccine.
Who else, Doc, besides pregnant women, who else falls into that category?
Well, people older than 65 years, people who've increased risk to influenza, like healthcare workers, often children younger than 5 years, but I think they should be older than 2 years. People older, I've mentioned HIV, AIDS, asthma, heart, lung disease, diabetes. Those are the people.
Yeah. Dr. Kaplan, are you concerned as we go into the winter season that this is the second winter season we're now facing in the midst of the COVID-19 pandemic?
No, but we didn't see an expression of flu much last year, so I'm expecting that flu will be a little bit worse this year, because viruses to continue living have got to spread, and already the flu I've seen this year, people have been quite sick. So I would expect the flu to be a little bit worse this year because it didn't manifest last year.
So that's very worrying. Yeah, that's very worrying indeed. So a good time to get the flu jab. In terms of the vaccination program, we know a number of our healthcare workers have already received the jab. Are you part of that cohort?
Yes, I am.
And how do you feel?
I have had the vaccine through the Sisonke program at the Johannesburg Hospital, Charlotte Matseke Hospital. But what is very important is that people carry on wearing their masks, terribly so, carry on keeping apart from each other and try and stay away from congregated areas. What happened in India was a disaster, and we must stop that happening from our country. So we carry on the same as last year. Be vigilant. You put on your mask. You stay away from people. You just take care. Use sanitizers, and we'll get through this.
Yeah, just stick to those non-pharmaceutical interventions. Dr. Dave Kaplan, it's been a great pleasure having you back on the AM Report after a bit of a break. Hope to see you again very, very soon as we continue to track various stories around the COVID-19 pandemic. There you have it. If you're thinking about getting a flu jab, it is a good idea to do so 2 to 3 weeks between getting your flu jab and your COVID-19 vaccine.